Now News 3 is taking action for your health this morning. Flu season is in full swing, and as many people look to try to avoid it, some people are coming down with something else.
You can't win for losing. When you start to feel symptoms, how can you tell if you're coming down with a flu or maybe just a severe cold? Let's get some help from the guy who knows, medical expert Dr. Ryan Light from TPMG at Greenbrier Family Medicine.
So Dr. Light, how can we tell the difference between the flu or just a really bad cold?
Well, it's really difficult sometimes because the symptoms are very similar. However, the flu usually is more severe and it comes on more quickly than the common cold. But sometimes you just need that rapid flu test to really distinguish between the two.
When we're distinguishing, what are some of the main differences?
Well, the flu comes on quickly. It hits you very quickly. It gives you those body aches, that fatigue, feeling like you got hit by a bus. So you're going to have that high fever. You're going to have a cough as well. The cold usually comes on slower. Usually starts up in our heads, so that runny nose, congestion, getting that sore throat, then moves into the chest over a few days, and it's less severe.
Do you feel like you've been hit by a bus?
I feel like it was a slow roll by a large Tonka truck, so it might just be...
Maybe. So at what point should we be going to the doctor with these symptoms?
Well, if you have those flu-type symptoms we just talked about, really you want to get in there within the first 48 hours. That's when we actually have a treatment for it. After 48 hours, it's just going to be supportive care, so really you don't have much to offer at that point except lots of bed rest and lots of chicken noodle soup like your mama's.
Oh, yeah. So we talked about that particularly severe strain of cold. Is that what's hitting a lot of people here?
Well, we do have this cold strain out there right now that's an influenza-like illness. It kind of has similar symptoms, not quite as severe, but it's starting with that head congestion, running into a sore throat, moving into the chest after about 3 to 5 days. The bad part is it's lasting out there 7 to 10 days, which is uncommon for it.
Okay, and we've seen that, I know you've seen it at home, probably in your places of work. We've seen it in the News 3 building, too.
This very room.
So what can we do to kind of stay out of that number of folks who are getting this cold and the flu?
Well, the biggest one is the flu shot every year, so we recommend that always. You want to make sure you got good hand hygiene. That goes throughout the whole year, so that's going to prevent that summer cold as well. So make sure you're washing your hands frequently. You want to make sure you got good cough and sneeze etiquette to protect your neighbor, so that means, coughing and sneezing into your elbow. If you're sick, stay home. Avoid people who are sick.
I was in an airport Sunday, and I was amazed at the number of people in the year 2019 who do not know how to cough properly.
Oh, yeah, just coughing all out and open.
Before we let you go, Dr. Light, can you confirm on television that it's Erica who got me sick?
Oh, my gosh.
I can neither confirm nor deny.
If you could only see the look I'm getting from off camera right now. Dr. Light, thank you.